Hello everyone, welcome to RAAONLINE. I am Dr. Abhinaya. I am a consultant pediatrician. So in the chapter discussion on neurology, the next topic of discussion is on brain abscess. So this is going to be a very brief presentation, and I am not sure how many of you have seen brain abscess in children, but nowadays there is a very sharp decline in the incidence of brain abscess. So thankfully to the better vaccinations, the better diagnostic modalities and proper treatment, etc. So the incidence is also very less, somewhere between 0.3 to 1 per lakh per year, and it is quite common in immunocompromised hosts when compared to the immunodefensive hosts, right? So some of the risk factors that we see for brain abscess are either there can be a contiguous spread, so like from an associated infection somewhere in the meninges, like meningitis, or an infection in the ear, middle ear, that is otitis media, mastoiditis, sinusitis. So these are all causes for a contiguous spread that can lead to a brain abscess, or there can be a direct compromise. So whenever there is a trauma, when there is a penetrating head injury, or in case there is a surgical procedure where a shunt is placed, so that can be like a VP shunt or Omaya which is placed, and that will serve as a focus for the brain abscess. So these are all some of the risk factors for a brain abscess. One more is in children who have a right to left shunt, and septic emboli is also a cause. So what is the pathology behind the cerebral abscess, brain abscesses? So in children it can occur in both hemispheres, and in adults of course left side is more common. So most often 80% are going to be either in the frontal, parietal or temporal. Most often it is a single brain abscess. Multiple brain abscess is only 18% thankfully. And frontal lobe abscesses will be usually secondary to a sinusitis or due to an orbital cellulitis because of the contiguous mode of spread of infection. Whereas temporal abscesses or cerebellar abscesses can be due to otitis media or mastoiditis. So what is the most common organism which we should know? Okay, so brain abscess, we should know what is the most common organism. So far we have seen what are the risk factors where the brain abscess is there. It is single or multiple, and immunodeficient host, or it is most common immunodeficient host we have seen. Now we are going to see what are the infections. Okay, next we will talk about how are you going to diagnose it and treatment. That's all. So most common it is streptococcus. In streptococcus, the Streptococcus aeruginosus group is the most common entity for brain abscess. So Streptococcus aeruginosus, constellatus and intermedius. So these three are the most common to cause brain abscess. Apart from this, whenever there is a penetrating brain injury, the penetrating abscesses or a VP shunt, some foreign material which is present, then you have to think of Staph aureus to be the most common organism. Apart from this, gram-negative and anaerobic organisms are also implicated. Neonates, think of listeria. And what about polymicrobial organisms? That is also less. So brain abscess is mostly solitary. Etiology is also mostly a single organism. I told you, no. So multiple abscesses only in 15 to 20%. Remember that, such a very small percentage only. And then polymicrobial, around 25% of cases it is polymicrobial. If it is an immunodeficient host, it can be fungi or nocardia, which we should cover also.